Hi, everyone. Welcome back to our podcast.
Hi, everybody.
So today we have a big topic.
Yeah, and I think one that's pretty important.
It is important. I think it needs to be a part of most people's mind-body healing journey.
Mm-hmm.
And our topic for today is 4 ways we resist our emotions that can trigger chronic pain and symptoms.
Yeah, and when we talk about it being a big topic, I think it's big because we really need to look at the fact that resisting emotions can impact us negatively at times.
Yes.
Yeah.
And so here's kind of the breakdown. I have a flow chart that I give clients.
Okay.
And so when we talk about why resisting emotions trigger pain,
Mm-hmm.
and so we all have important emotions that we need to experience. Love, joy, appropriate guilt, sadness, fear, anger, disgust. Right now with our kids, we're watching that Emotions movie.
Mm-hmm.
What's it called again? I keep forgetting the name of it.
Inside Out.
Inside Out.
Yeah.
Core emotions.
Yeah.
Important emotions. So we all have these.
Yeah.
No matter who you are, you're going to have the whole spectrum of emotions.
Yes.
But then we resist them. And we're going to go through the kind of 4 main ways people resist emotions.
Yeah. And I think it's a common thing to resist emotions. Most people, whether they're struggling with chronic pain or not, struggle with feeling emotions and welcoming them.
Yeah.
Yeah.
And what happens when we resist emotions is it actually causes our nervous system to become really dysregulated.
Mm-hmm.
And so a lot of times when people are like regulating the nervous system, some people force themselves to always be calm.
Mm-hmm.
That's not what we're going for.
Yeah.
We have important emotions, and when you resist them, it causes this dysregulation.
Mm-hmm.
So fight, flight, freeze, shut down. This is what takes place.
Mm-hmm.
And then what happens after that is the brain follows suit. And as a result, it's going to trigger chronic pain or symptoms.
Yeah. And so understanding this emotional piece is so important. And it is about like brain retraining and rewiring, but also about, okay, how do I learn to be okay with my emotions as well?
Yes. And actually feel safe with them.
Yeah.
Because that's a whole other topic for another podcast, actually
Mm-hmm.
feeling safe with emotions.
Yes.
But at first, we just need to identify how are we resisting them.
Yeah.
Because that's the starting place. If you want to identify, experience, and release emotions, we need to identify first what is the resistance to actually feeling them and being with them.
Yeah.
And so we came up with a list of 4 ways
Mm-hmm.
we can resist emotions. And we'll dive into each of these topics. But at first, I'll just kind of name them off. So alexithymia, number 1.
Okay, that's
We're gonna
that's
dive.
a confusing name
I know,
there.
it's a confusing name. I like the name though, alexithymia.
Okay.
Being really just unaware of emotions. And we'll define this in a second.
Mm-hmm.
Number 2, invalidating your emotions.
Yeah, which I think is a common one.
Mhm. Number 3, viewing emotions as dangerous experiences.
Mm.
And number 4, using defenses or avoidances as a way to prevent emotions from taking place.
Yeah. Yeah.
So let's dive into number 1.
Okay. Explain more of this alexithymia.
Hey, you said
Did
it
I
right.
say
You said it right.
right?
I like it. So I got a definition
Okay.
out of a study.
Yeah.
So
Good.
it's like,
Good.
how do we define alexithymia? So I'll read this to you. Alexithymia can be defined as 1, difficulty identifying and describing feelings.
Okay.
2, difficulty distinguishing between feelings and body sensations related to emotional activation. Number 3, resisted or limited imaginative processes. And number 4, a cognitive style that's really directed towards the outside. And so what'll happen for people with alexithymia is they know very little about their internal state.
Mm-hmm.
And so it's one way that it takes place. It's a defense that happens for a lot of people. And I think it's theorized to really be related to trauma.
Okay.
It's theorized to be related to childhood adversity.
Yeah.
And so people just shut off completely.
So it's a protective mechanism.
Yeah, that's the theory around it.
Are we thinking it's more than just being unsure of what we're feeling? It's kind of deeper than that.
It's to the point where people can't even identify how they're feeling emotions in their body, because emotions are always physical sensations.
Yeah.
They are. They're not thoughts.
Right.
But what will happen for people with alexithymia that I'll see is all of a sudden they'll be having pain or symptoms. And there was no awareness that emotions were happening.
Okay.
And so for myself, there was definitely a flavor of this that I had to overcome, where I didn't really understand emotions took place in the body. I was aware of my thoughts.
Yeah.
And I could feel things in my body, but there was a disconnect there. And for some people, it's even more severe, but there was a disconnect that was taking place that I needed to overcome. And so it's kind of the first way that we resist emotions is we just completely shut off from connecting to them.
Right.
And this isn't always a conscious choice. I think sometimes we just learn to be this way in childhood, and then it just continues on.
Yeah.
And so that's the first way. Now, number two.
Okay, I'm pulling it up here.
Yeah.
Yes, I got it.
Number two, invalidating your emotions.
I think people can identify with alexithymia, but I think people can really identify with invalidating emotions. I think that is something that's common for a lot of people.
Yes, it is, where people understand they're having emotions. They're a little judgy about them. We're judgmental. We criticize ourselves. And what takes place is people invalidate them.
Yes. And a big way people do this is, oh, I shouldn't be feeling this way. I'm fine. Just push on, that kind of language.
Yeah.
Yeah.
And it makes sense that this results in resistance, because if you invalidate your emotions and you tell yourself, it doesn't make sense that I feel this way right now, I shouldn't feel this way, then you're going to try and push that emotion down because you don't think it makes sense for the situation that you're dealing with.
And sometimes we can look at a situation logically and see, okay, this seems strange that this emotion is there. Like, I don't think that's necessarily bad, taking a look at the situation, but they're still acknowledging and experiencing that emotion at the same time.
Yeah. And I think some people are short-sighted with this, where I'll give an example. If I have a stressful week.
Yes.
And I come home, and for instance, last night, I wasn't too grumpy last night, but
sometimes he's grumpy.
Sometimes I'm grumpy.
Sometimes he's less grumpy.
And my son hasn't cleaned his room.
Which is a sticking point for you.
It's a sticking point.
It
bothers me. I'll be honest with that. But maybe my reaction's a 4 out of 10 being grumpy about it. I love how grumpiness is what we're defining this as. But really, it's a 2 out of 10 issue. It probably takes someone 20 minutes to deal with them. It's not the end of the world. But if I have had a very stressful week or a stressful month, or I've had these life events that cause clutter to be very disorganizing for my nervous system, that emotion that I'm feeling in the moment makes sense. So people just don't go far enough back in taking like more of a life view
of looking at why that emotion is there. What is that bigger picture connected to that emotion?
Yeah, it's like when people have a small work problem and they're feeling like an 8 out of 10 anxiety. It's not just the work problem that's resulted in that feeling. It's every moment you've had in your entire life that's led up to that moment. And so it is valid. That's the thing, is that it's valid. Now, of course, we don't want to like explode on people when we're feeling anger either. I think anger can be empowering, but we also want to be careful how we're using it. Right.
Well, because in that situation last night, if you had exploded about that specific situation of the room, what would have that looked like to everyone around you?
Yes, it wouldn't have made sense. And people would be like, Tanner's emotion isn't valid given the circumstance.
And then we probably would have all invalidated that emotion. Like, what are you doing?
So you can see how this naturally happens.
Yeah.
But you want to be careful that your emotion is valid given your life. It makes sense how you got there. You may not be able to put the pieces together.
Yeah.
But that's like, we need to start with validation because that's going to lead us to actually approaching the emotion and to actually feeling safe with it.
Well, and I think with, with people that I work with, a lot of our time together is spent validating emotions together.
Yeah, validating the experience
Yeah.
that someone's going through.
Yeah.
Any great therapist is going to be doing that
Mhm.
because that's important. You're never going to create a sense of safety with emotions if we keep criticizing ourselves and judging them. And we're not even going to approach the emotion if that's the case. We're going to kind of try and just shove it right down as much as we possibly can.
Yeah.
So that is number 2.
Okay.
Number 3.
Yeah.
Oh, lost my spot. Number 3.
Mhm.
This really comes from a pain reprocessing therapy lens.
Yeah.
They kind of theorize this in their approach. And I like it. And number 3, the way we resist emotions is we just view them as dangerous.
Mhm. And when you say dangerous, like how do you define that? What do you mean by dangerous?
I mean that there is an inherent fear of the emotional experience themselves.
Mm.
And so here's the thing around emotions is, as we've said, they're all physical experiences.
Yeah.
And the reason emotions are safe is we're meant to feel the full spectrum.
Mm-hmm.
We're designed that way. And they're just sensations in the body and they're temporary.
Mm.
But we lose sight of this. And even I lose sight of this sometimes when I'm like feeling fearful or something.
Yes.
I forget that it's only been a period. It hasn't been,
Well, and it's funny, you're right when you say like lose sight of it, because I feel like I often have to remind you, okay, this is temporary. But it's true, when we're in it, it's much harder to do that. And when we have the thought narrative that starts going around when we're experiencing that emotion, that can really shift how we experience it too.
Yeah. And I think a lot of this stems back to childhood on how emotions were modeled.
Yes.
How your caregivers or peers treated you when you felt emotions. Because that's going to determine if you view emotions as a safe experience or as something that's dangerous. So for example, if you had a parent that every time you felt sad or angry or fearful, they're like, don't feel that. You're being too sensitive.
Yeah.
Right? And was critical of you. Or emotions were never modeled in your home.
Right.
Or emotions were modeled, but they weren't modeled in a way that actually showed someone moving through them in a safe way.
Right.
You add all these things up, all of a sudden emotions, it makes sense why people view these emotional experiences as potentially dangerous.
Well, and that's right. And then we continue to operate the same way in adulthood, whether we kind of realize it or not.
Yeah.
So taking a look back at how these were modeled to us in childhood, I think is really important, but it doesn't mean all is lost.
Yeah.
That's just good information to go with.
Yes.
Yeah.
And I even think for myself, when I look back on my childhood, anger was something that was modeled lots by men in my life.
Yeah.
It was. And not in like a really explosive, abusive way. Like it just was like peers at school, other boys would get angry. And that was viewed as like an okay thing for boys to experience. I know sometimes it can be a little gendered, but that's the interpretation that I took. But anytime a boy showed sadness or fear at school, they were made fun of.
Right. And so what did that show you, Tanner?
And it showed me what emotions are safe for me to experience. And so it's much easier for me to experience anger. And that's okay. I've had to do a lot of work.
Yeah.
Things like fear or sadness or feeling guilty in an appropriate way, that's okay. That's welcomed.
Right.
And by actually starting to feel safe with emotions, the resistance lowers of them.
Okay. And so it comes back to safety again, which is what you're saying. It's being okay to feel that, allowing ourselves to experience those emotions.
Exactly. Yeah. But it's important for people to identify what emotions do I view as dangerous.
Yeah.
And it's not always the unpleasant ones.
Why would someone view pleasant emotions as dangerous?
So things like joy, love, things like even calmness can be really hard. It's unfamiliar for people.
Yeah.
I think sometimes it roots back to trauma.
Yeah.
So love or connection can be viewed as a very dangerous thing.
Mm.
Or people have this belief that they're not going to last,
Mm-hmm.
that they're just going to go away. And so it's really common, like if people are listening and are identifying like, whoa, like I do view love or joy as a dangerous thing. That's not uncommon. Like that's a much more common thing than people think.
You're right. I think often people think they're alone in that, but that's not true.
No, it's not true. So now moving on to number 4.
Okay.
This comes from some of Dr. Schubiner's work.
Yeah.
And so it's when we're using defenses or avoiding feeling emotions.
And so what would that look like? Like for you, Tanner, what were your defenses around feeling emotions?
Yeah, well, you even think of my teenage years, this became drugs and alcohol.
Yeah.
I've used food. I've used exercise.
Right. And how is that a defense against feeling those emotions? Like how was that linked to that?
So if I started to feel things that I couldn't tolerate, I would resist them by doing any of those things to try and push them down.
Yes.
Even when my pain symptoms came on, I kind of had this cognitive style, like really overthinking things and being in my mind and excessively working, excessively working out. Like these were all ways that I was just trying to push down anything that I was feeling.
Yeah. And it's funny because I talk with people a lot about like distraction or doing, and that's not necessarily bad, but we don't want to do it if we're avoiding. We don't want to just jump to that and ignore the emotions that are going on.
Yeah. Yeah. And it can be small things that people can notice as they go through their day. Like I'm still rough, like can be bad with this is humor.
Yes.
Right.
It's funny because I think people have knowledge about that like they use humor to deflect, but it's hard to stop that for people too.
It is. So I'm much better at it now, but in the past when anything serious would happen, I'd make a joke or I'd make light of it.
Right.
It didn't always go off that well. But that was me trying to deal with my feelings of discomfort about engaging in some type of emotional conversation. Yeah. But we can do this in our mind as well.
So what would that look like?
So like more mental defenses, this could be things like trying to think about something else.
Okay. So literally distract in our own head.
Distract. I think this is what like excessively working did for me is I was always thinking about something else.
Right. Yeah.
But we get this. I think it even happens for people with their pain or symptoms where they're hyper focused and obsessing about that instead of feeling maybe the root cause underneath, which is all the emotion that's taking place.
Yes. Yeah, for sure it is. And once people start tapping to that emotion, sometimes things shift for them.
Yeah. And we talk about avoidances as well. Like we have lots of things we can avoid so we don't feel emotions.
Yeah.
This could be certain places, certain people, certain environments. Like with trauma, it comes down to memories a lot of the time where people are avoiding thinking of a certain memory consistently.
And that makes sense, especially if it's very distressing. So for those people, when, with this podcast, what would you say to those people? Yeah.
And when we're dealing with things like trauma, it can be really good to be working with someone.
Right.
So they can walk you through that because it's not like you just need to start approaching these memories.
No.
Like that can be incredibly overwhelming and almost re-traumatizing some of the time.
Yes.
So we need to be cautious with that.
Well, and that's right. And if there is an approaching, that if people do start approaching, it is making sure that it's safe and that it's supported. Yeah.
Yes. So these are kind of the 4 ways we've defined in terms of how we can go about resisting our emotions.
And so people know this now, like we've outlined them, but now what?
And now it comes down to people spending some time and reflecting on this.
Okay.
And then keeping track. I did this early on in my healing. I really tracked for a few weeks. I was on the lookout for like, how am I resisting emotions?
Okay.
And it could be any of these 4 ways that we've kind of defined, but that's a really useful activity.
Mm-hmm.
So whether it's number 1, alexithymia,
Mm-hmm.
number 2, invalidating your emotions,
Yeah.
number 3, viewing them as dangerous, or we come down to number 4, which is using defenses or avoidances.
And so when you were noticing this or you're tracking this, did you try to change it, or did you just kind of gather evidence at first?
At first, it was just becoming aware, and I
Yeah.
became super aware that so often throughout my day I was doing this.
Okay, so you're catching it. It became easier to notice as
Yes.
you're looking at it.
Because then once you can recognize the moments you're resisting emotions, then you can move on to the other work of identifying what you're feeling,
Yes.
experiencing it somatically,
Yeah.
and then releasing it.
Well, and that's right. Like developing awareness creates choice.
Yeah.
If we know, then we have choice to maybe do something differently.
Exactly.
Yeah.
So thank you everyone for listening, and we will talk to you all next week.
Talk to you next week.